I am the host of the show, Thelma Illens, and with me to do justice to today's topic is Dr. Tunji Alakija, a medical officer working with the Sickle Cell Foundation Nigeria, Idera Basulere. He graduated at the College of Medicine, University of Lagos in 1977 and later proceeded to the USA for the postgraduate course. He worked for the Lagos State Health Service Commission at the Pediatrics Department of various hospitals, including Massey Street Children's Hospital, Ekpe General Hospital, Oniko Health Center, and then till he retired in May 2016 and then joined the Sickle Cell Foundation Nigeria. He is the pioneer founder of the Pediatric Sickle Cell Clinic of Ekpe General Hospital in 1992 and also the pioneer founder of the Sickle Cell Clinic of Oniko Health Center, Lagos. He's also a trained genetic counselor in sickle cell disorders, and of course his special interests are care and management of children, specifically, with a sickle cell disorder. You're very welcome to the studios, Dr. Alakija.
Thank you very much.
Okay, so today on the show, we are talking about sickle cell trait, implications for the sickle cell disorder. So I know for quite a while, or in fact every single time that we're here, we're always talking about the sickle cell disorder, and then somehow in between we mention the trait. But today is the special focus on the sickle cell trait.
Yes.
So I'm going to ask you first, really, for the benefit of those who do not, have complete knowledge of what the sickle cell trait is. What is the sickle cell trait?
Thank you. Sickle cell trait is a condition, like we all know, blood disease. It's a condition in which the patient inherits the gene for the A hemoglobin.
Okay.
And from one parent, he inherits the gene for the A. And then from the second parent, he or she inherits the gene for the S hemoglobin. So he has a combination of A and S. It's different from the sickle cell anemia, where the patient has S from one parent, S from the other.
Okay.
This one, he has inherited A. A is a normal hemoglobin. We have the abnormal, or let me call it unusual. Don't let me use the word abnormal. Unusual. We have other unusual hemoglobin patterns, like C, hemoglobin D, hemoglobin E, hemoglobin thalassemia. These are the unusual ones. Hemoglobin S is the commonest of the unusual ones, but the normal one is hemoglobin A. So wherein one of the parents has donated hemoglobin A and the other parent has donated hemoglobin S, then we have the child having hemoglobin AS. That is the one we call sickle cell trait. It's a carrier. It's not the full-blown one. Yeah, that's it.
Okay. So is there a point where a carrier can degenerate into having the disorder? Can that actually happen medically?
Now, it's not possible for the genotype to change. That's the first thing I would say. The genotype you are born with is the one you remain and attain throughout your life. The sickle cell trait we are looking on today, hemoglobin, the genotype of hemoglobin AS, is a peculiar one. And most of the time, they don't really have much problems like the sickle cell anemia hemoglobin SS has. They don't. They live virtually normal lives. Many of them don't have any complaint like we have in the sickle cell disease. But under certain conditions, they can have some symptoms similar to sickle cell anemia. The complications can there, like bone pain under certain conditions. I will mention that later. Breathing difficulties can come, but normally, when these other conditions are not there, they live a normal life without any problem. They live long. In fact, they themselves don't even suspect or know that they are sickle cell trait carriers.
Okay. So can one with a sickle cell trait, can they donate blood? Is it safe?
We can take that, if
However,
AA is not available, we prefer the normal one, genotype AA. But where the AA is not available, we can also take the AS. Yes.
Okay, but and that's safe.
Yeah, it's safe.
Absolutely safe.
Absolutely safe.
Okay.
That is, we've excluded other things like infection and other things. Yeah, it's safe.
Okay, so I know that one of the things that we often talk about when we talk about persons with a sickle cell disorder, we mentioned that you're, prone to the high risk effects of malaria. Do you have those with the trait? Do they suffer same, or
Okay.
are they free of it?
Now, the sickle cell trait has the good part of it, has the bad part of it, has what I may call the deadly part of it.
Really?
Yeah, among the good parts of the hemoglobin AS sickle cell trait is that number one, the S part of the AS protects against malaria, the very, very Plasmodium malaria. It protects against it. So children that have the trait, they are not affected by bad malaria. Yeah.
So
they
did you
survive.
say the S part, or did you mean to say the A part?
No, the S part of it seems to protect them. Whereas in the sickle cell anemia, who has double S, they succumb to very bad Plasmodium malaria. Even the AA, they succumb in early childhood to very bad malaria. In fact, they die a lot. Yeah, in the first 5 years. If you put the three of them in a sickle cell, in a malaria endemic area, you'll find that even the AA, most of them die.
Yes,
Because the Plasmodium in malaria parasite, they seem to want a very, very rich environment of oxygen, which AA has, and they kill.
So it's true. It's not a myth or a rumor when people say those with AA are actually, are they have high prone risk to effects of malaria.
Oh yeah, most of them die. And the same thing you find in those with SS. Even though there is S, but the sickle cell anemia, most of them die in the first 5 years. Whereas those with sickle cell trait, AS, they survive in very bad malaria areas.
And you're saying it's the S that protects them?
Yes. It protects them a lot. So many of them don't die. And that is why in most malaria area like Nigeria, for instance, in the early childhood, we find most of the AS surviving. And by the time they meet with another AS, sickle cell comes in again. They survive a lot. AS. And by the time they marry and have another AS, you find a lot of sickle cell coming in. So that is one of the protective things. And number two is that the AS, you find that we are talking of AS now, the sickle cell trait.
Yeah.
You find that apart from the fact that malaria seems to be not affecting them so much, they don't seem to have most of the problem that sickle cell anemia has. All the bone pain crisis, all the other crises that sickle cell anemia has, they seem to be protected because the A protects from sickling effect. Are you hearing me?
Yeah.
When we have AS, the A part of it in the red blood cell is much more in quantity than the S. So where the S wants to cause sickling, like in the sickle cell anemia, the A is like saying, "Oh, I'm big, I'm the boss, I'm the boss. You can't do." So they don't have sickling in their red blood cell, like the sickle cell anemia we have. So all the bad effects of sickling that we have in sickle cell disease, they don't experience it. Pain and many other things like that. They are free. So that is the good part of having AS.
All right, 13 minutes gone past the hour of 13. We're 36 minutes gone by my time. 36 seconds, I beg your pardon, I meant to say. Surviving Sickle Cell on your number one family radio 92.3 Inspiration FM. That's what you are listening to. And it's in partnership with the Sickle Cell Foundation Nigeria and in honor of the memory of our beloved Tosi Buckner. My name is Thelma Ilens, your host, and the doctor in the house is Dr Tunji Alakija, a medical officer who works with the Sickle Cell Foundation Nigeria, Idiaraba Surulere. Sickle cell trait, that's the one we commonly know as AS, is what we are talking about today. If you have some questions, concerns, fears, regarding this, you can get through to us via the numbers 0700 923 923 923, or you can simply text your thoughts on our WhatsApp platform via the number 0817 313 61 9293. So yes, we have talked about the good parts, the advantages, or the things that those with the AS, the carriers, seem to enjoy.
Yeah.
You know, that others, you know, other genotypes don't. I mean, including the AA, because I'm surprised. It's news to me that you say that unlike what the SS and the AA, who are actually prone to the high risk and effects of malaria, the AS are safer, and it is the S part of it that actually protects them against it. So it would seem like they're superheroes, if you ask me. Yes. So however safe they may appear to be, are there some complications, you know, that come with this, the carriers of the sickle cell?
Let me say that is the third part of the discussion, the deadly part.
Okay.
But let me bring in the intermediary one.
Okay.
I've talked about the good part of it.
Let's
They are
take it nice
immune
and
from
slow.
malaria.
Okay.
They don't have much of the. Now, the intermediary one is like the bad part of it is that they can transmit the S to their offspring.
Okay.
You know, AS. Their children can also inherit the S, which can then give some trouble if they should marry somebody with S
the
again.
carrier. Okay.
And in this our country, in fact all over the world, many people are not aware of their AS trait
Status.
genotype because they feel they're okay. Most of the textbook in the good old days will say AS is innocuous, is a benign thing, you don't have to worry about it, no trouble, you're just AS. So that is they can transmit it. And wherein they don't go for counseling as an SS will go, you find that it's more a case where they can marry people with AS without proper counseling.
Okay, hold your thoughts. Let's take this call. Apologies for keeping you waiting. Hello, good afternoon. Good afternoon, sir. What's your name, please?
Thank you, sir, for that question.
10 kids.
Thank
and
you,
one
sir.
just came out with the SS.
Okay. Now, it's a question of chance when a couple meet. The hemoglobin genotype of the mother and the father, each one will donate one of the two, maybe AS. When they meet, he'll donate either A or S. The other couple will also donate either A or S. It's pure chance what you donate. And you find that in each pregnancy, if the man donates the S in the first pregnancy and the wife also donates the S, the child will be SS. Now, listen carefully, sir. I'm not saying that 1 in 4 children will be SS. There is 1 in 4 chances that that child will be SS, 1 in 4. There is a lesser chance that that child, only 25%. But that happens in each pregnancy. If the mother should donate the S and the father should donate the S. Now, if they come again the second pregnancy, and let's say the father again donates S, the mother donates S, you see that the child will again, the second child will be SS again. If during the third pregnancy, the father donates S again, the mother donates S of the AS, the child again will be SS, making 3 SS. If in the fourth pregnancy, the father donates A and the mother donates S, then the child will be AS. So these are random things. You can have 10 children and all of them are AA. If the father donates A and the mother donates A, then the child will be AA. And maybe at the 11th pregnancy, he donates S this time around, and the mother donates S, it will be SS. So it's pure random thing. You cannot say that out of 4 children, my one family has 3 SS. Why should my family have? It's pure chance. Anything can happen.
So you're saying with Ben's parents, they were just lucky?
They're just lucky. Pure luck.
All right, but is there a way to control it? Really? To actually say, I want to be able to donate to my
No.
Doesn't happen like that.
It cannot. It's pure
So
chance.
it's pure chance. Okay, I thought we could take this call. 0700 923 923 923 is the number to call. Let's see if we can take this call before we take a break. Hello, good afternoon.
Thank you, sir. You see, the AA, it is thought that the AA, the red blood cell in the AA, has plenty of oxygen. It's well oxygenated.
Right.
And the malaria parasite likes to survive in that kind of atmosphere where there's a lot of rich oxygen. So with the AA, despite the fact that they have plenty oxygen, the malaria parasite loves that And the malaria parasite can survive in that kind of condition and do its work of killing people, making them sick. But the AS, the oxygen in the red blood cell is not very rich. Because the oxygen is not very rich, the malaria parasite cannot survive in that kind of atmosphere, and so the malaria parasite dies off. So you don't have the effect of malaria so much in AS, because the red blood cell they are not rich in oxygen, and it's not conducive for the malaria parasite, so it cannot do its work.
Summarily, you're saying the parasite thrives in a better oxygenated
yes,
blood.
Which AA affords.
Wow. So
Which
who's faulting it now?
AA affords a better oxygen.
This is amazing.
Yeah.
This is an amazing finding. Lagos, we have to take a break. When we come back, we'll see if we can take a couple more calls. I feel that there are just more questions. Dr. Alakija, you have no idea. It sounds like you're performing magic. This is not ignorance. We did not know this. Lagos will be back. Back 4 minutes to step aside. Okay, 92.3 Inspiration FM is where you're at. Surviving sickle cell. We've been talking most interestingly about sickle cell traits, implications for the sickle cell disorder. And of course, you know you cannot completely talk about genotypes without mentioning the other ones that we're aware of, like the AA, the AS, and then the SS. And most intriguing, or should I say, there's just been a revelation that has, turned tables or are shaking tables right now, because some people just got to find out, why it would seem that as an AA, which was generally known and accepted as the, the gang genotype, why it would seem like, yes, we're always falling ill, and then your spouse or your sibling who has the carrier, seems to be the stronger one. And then we just found out that the malaria parasite, of which those with the SS are not able to cope with, because, there is no oxygenated blood as against those with the AA. Now, as an AA person, your blood is so highly oxygenated, and therefore makes the parasite, that produces malaria. It makes the parasite thrive, and that's why those with the AA, they really come down hard when they have malaria, whereas the ones with the AS do not have enough oxygenated blood, so the parasite cannot thrive. And so I'm asking Dr. Alakija quickly before we go, what is the glory? Where is that crown when you say, oh, what's your genotype? And you proudly say, I am AA. What's the big deal?
Now, the glory, so to say, of being AA, or being AA, is that you are not, you don't succumb to all the complications of sickle cell disease. Sickle cell disease itself has many complications, like we all know.
Right.
Bone crisis is very common. Sometimes they have chest infection, which we call chest syndrome. Sometimes even they have a stroke. Sometimes they have acute vascular necrosis of the leg and they are limping.
Right.
All the various complications, as an AA, you don't have it, because these are complications of S, the sickle cell, which causes the sickle
For
genotype.
both the disorder and the carriers?
No, yes, both of them.
Okay.
Once you are A. But one thing we need to know is this, that most people don't know the deadly part of being a carrier.
Okay, can we look at that quickly?
Very,
Because
very
we're honestly out
just,
of time.
just now, when somebody has AS, there are risks involved also, which many people don't know, especially where there is low oxygen. Then they can have problems just like a sickle cell disease person. Where there is high pressure, they can have problems just like sickle cell. And that is why most of the aeroplanes, they don't allow their pilots to be AS, because under very, very high altitude and low oxygen, problems can come, just like a sickle cell person. Those who are running and doing exercises, even the military people, the police, when they are bringing in their people, they should know about AS, because under strenuous exercises, they can go into crisis. Some have even died because they don't have maybe oxygen, or they're overstressing themselves. When conditions like dehydration is there, they can go into crisis. Even AS. When conditions like infection is there, an AS can have the same problem like an SS. So these are the various bad conditions that they should prevent. Once they know that this person is AS, they should make sure that all those conditions are not there, because they can present complications just like in sickle cell disorder patients.
If care is not taken.
And some of them have died, yes.
Okay, do you have any last words before we go?
The last word I'll say is that everybody that wants to employ people should find not only SS but AS. They should screen them not only for SS but for AS, because AS under certain conditions can behave like sickle cell, and so they should make sure that they don't put them under strenuous exercise, military training, trying to put people into the police force and take them through strenuous thing, oxygen that is very low. They should be careful, because some of them can go into crisis and some can die.
All right, so that's a call to employers of labor out there. We're not saying no, do not employ people with the carriers and then the disorder, not at all. But we're saying be considerate, show some love. Love people really like you love yourself. I mean, that's just what the word says out there. But yes, we honestly have to go. Join us same time next week for another interesting episode. I'm not sure what it's going to be, but I do know that every single time that we come here at 1 o'clock for Surviving Sickle Cell, there's always one revelation or the other. I want to say a very big thank you to Dr Tunji Alakija from the Sickle Cell Foundation Nigeria, of which Inspiration FM is doing a partnership of this show with. And yes, to our beloved Tosi Buckner, and we say may her soul rest in perfect peace. My name is Thelma Illims. I'll be back here Monday for the tea break at 11 a.m. In the meantime,